If you are one of the millions of people who suffer from urinary tract infections, bladder infections, kidney infections, please stick around. This message is for you, but it is also for people who do not suffer from those infections, because this message is a message for the human race, and it's a very important message. It is not necessary to take antibiotics for urinary tract infections in most cases. I'm going to explain why. First of all, most cases of urinary tract infections are caused by a single microorganism, E. coli. And there is a scientific natural medicine that has been so well researched and so well documented and published in so many medical journals that many medical doctors, even specialists, even urologists, are prescribing it instead of antibiotics. However, there are still lots of doctors who don't. They still continue to prescribe the antibiotics. For the past 50 years or more, the American Medical Association and all of the major health organizations in the world have been screaming, begging medical doctors to stop being so casual, so irresponsible about prescribing antibiotics, because they are harmful. They do great harm to the human race, and this really doesn't make the news very often. This indiscriminate, irresponsible prescribing of antibiotics, it is estimated that between now and the year 2050, around 169 million people will die from these superbugs, these antibiotic-resistant microorganisms. The World Health Organization estimates that in 2019 alone, antibiotic-resistant infections caused about 1.25 million deaths, just that 1 year. And the problem is growing. And one of the most common reasons that antibiotics are prescribed is for urinary tract infections. And as I said, most urinary tract infections do not require antibiotics. There is a natural medicine, it's called D-mannose. It's a natural sugar. It has no side effects other than, in some cases, rare cases, some slight loosening of the bowels. Otherwise, no side effects. It's a natural sugar. In fact, our bodies produce a certain amount of D-mannose every day. D-mannose, I recommend it in the powder form, not the capsules. It is shown to be at least as effective as antibiotics in treating urinary tract infections, E. coli urinary tract infections. It only works on E. coli, but E. coli accounts for most cases of UTIs. And in most cases, it's a slam dunk. There's no downside to it. In fact, you can even take it preventively if you are a person who suffers from frequent UTIs. And I'm going to give you the dosage in just a minute. In a recent survey, 91% of medical doctors agreed that inappropriate antibiotic prescribing was a problem, but only 37% felt that it was a problem in their office. In other words, it's everybody else that's doing it, not me. This is one of the reasons why I repeat over and over, your doctor is not responsible for your health. You are. This is why I want to give this message to everyone, not just to people who suffer from UTIs, because it is a problem of the human race. Millions of people are dying from these antibiotic-resistant infections, these superbugs. And the problem is growing incrementally, and doctors continue to think it's somebody else's problem, not theirs. Now let me ask you a question. Let's say you're a doctor and you have the choice to prescribe for your patients who have urinary tract infections an antibiotic with all its attending side effects and this huge and growing risk that's going to kill millions and millions of people, or a natural substance that works just as well. And scientifically, D-mannose has been shown to work every bit as well as antibiotics, that has no appreciable side effects, that can be used preventively, and it's safe, it's natural, and it has been published time and time again in medical journals. Numerous studies have been conducted showing that it is definitely effective, it is definitely safe. So you have the choice between that and an antibiotic. Which are you going to choose? Now, if a doctor chooses to continue to prescribe antibiotics instead of D-mannose, what do you call that? I call it malpractice. I call it irresponsibility. You can get D-mannose at any health food store. There are lots of companies that sell it. You can get it online. I recommend it in the powder form simply because it's easier to dose. If you have it in capsule form, it's the same stuff, but the dosing is a little more problematic, and it's cheaper if you buy it in powder form. There are some D-mannose products that contain other substances like cranberry extract. That's fine, but not necessary. D-mannose does the job. So here's the dosage that I have seen be effective countless times over the years in clinical practice. The dosage is always 1 teaspoonful of D-mannose powder in a full glass of water. What varies is the frequency of the dose. So the first day, you start with 1 teaspoonful D-mannose powder in a full glass of water every 2 hours. Every 2 waking hours. You don't have to wake up at night and take it, but definitely take it at bedtime. The second day, you take that same dosage every 3 hours. The third day, every 4 hours, and then you continue at every 4 hours until the UTI is completely resolved. And then you may want to continue taking it for a while at bedtime. And if you're a person who has suffered from frequent UTIs, then you may want to just take it always. No side effects. It's not going to harm you. And because it's a sugar, it's pleasant tasting. It's sweet. If you are a woman who has suffered from UTIs over the years and taken antibiotics, you probably know about the antibiotic, the UTI yeast infection cycle. You get a bladder infection, you go to the doctor, prescribes antibiotics, you take the antibiotics, next thing you know you've got a yeast infection, a vaginal infection, which is going to be Candida albicans. So then you go back and you take an antifungal, and after a while you've got another bladder infection, and it's just a cycle. So if you have that problem, if you have recognized that you have Candida albicans, systemic candidiasis, yeast infection, what have you, go on my newsletter, longlifehealthy.life, and there is an article that discusses that and explains how to get rid of it, because there's so many products out there, Candida cleanse products, Candida killer products, and they don't really work because you have to destroy the biofilms. And in my article on my newsletter, it explains how to do that.